Hello everyone, welcome to the IJD podcast. We're the official journal of the International Society of Dermatology. I am Lily Becke.
And I am Anita Biro. We are the editorial managers of the IJD. In this podcast series, we'll spotlight the dedicated professionals who help shape our journal, including section editors, selected reviewers, and authors.
Stay tuned for a closer look at the people behind IJD.
Hi everyone. In this podcast episode, my guest is Professor Sorin Tiplica, the Associate Editor of the IJD. He will share his thoughts about the journal, and we will discuss about the sexually transmitted diseases. But first, let me briefly introduce Professor Tiplica. Professor George-Sorin Tiplica is the section editor for STI of the International Journal of Dermatology. He is the head of the dermatology clinic in Colentina Clinical Hospital, and he is a professor of Carol Davila University of Medicine and Pharmacy, Bucharest, Romania. He is interested in bacterial infections and parasitic infestations of the skin. He is the leading author of European guidelines for the diagnosis and treatment of scabies, pediculosis pubis, molluscum contagiosum, and partner notifications. Since 2021, he has been the chair of the UC Europe Council, a professional association fighting against sexually transmitted infections and HIV. Professor Tiplica is also the president of the UM's Multiple Joint Committee of Wound Healing. So, hi, Sorin. I'm happy to have you here in our podcast episode.
It's my pleasure.
Let's start with that you are a section editor of the IJD. Could you please share a few words? What was your motivation to join to the IJD? And since how long are you involved in the work of the International Society of Dermatology?
Well, first of all, thank you for inviting me to this podcast. It's an honor for me to be here and to be present in front of you, your team, and also in front of our readers and our members of ISD. Related to my involvement in the association, I think that I'm already a member for 10 years, but I joined the journal quite recently. I said 1 year and a half. And my experience here, it's excellent. If you are asking why did I join the team, maybe you remember that I wrote you an email presenting myself, introducing myself, and offering my support for the journal because I'm very interested in STIs. And I like very much your work. So I was there following the editor-in-chief for sure. And then I found out the team. It's a very nice team. All the other colleagues that I met during our editorial board were also persons of good quality, known for their involvement in the different field of medicine. And the concept that you brought to the journal, it's something very attractive because it's also using a lot of new tools, like everything is done by internet, and you prefer to meet us in direct conversation, virtual conversation, which is not happening in other journals. I can tell you that I had some experience before, you maybe know, but I'm very happy with this direct approach. And I feel that I'm at home with this journal, and I try to spend as much time as possible because I'm doing this with pleasure.
Yeah. Sorry, we are good friends actually, and we know each other many years ago. And I hope that I do not stress you a lot, because when there is an overdue manuscript, I used to text you and with WhatsApp, and I got response in a few minutes, even late evening, which is not really good probably for everyone, but I see it doesn't disturb you, and I'm also working until late night, so it's really great to have your continuous support, and your response is always in time. But what is the most challenging task in this position, being as a section editor of the journal?
Well, I think that there are different aspects here. First, in this work, we don't have to discourage the authors. Sometimes it's difficult to find the proper words to make the author understand how do you think the manuscript will improve. And I think that this is a challenging task. Find the proper words, try to not discourage them, but to explain them where they have to sharpen a little bit the manuscript, where it's place for improvement. And also when you have a major modification of the manuscript, you have to be very careful not to discourage them. I think this is important because at least in my field of STIs, there are not so numerous manuscripts and there are not so many persons oriented to these diseases. Therefore, when we have somebody who is willing to report something, who is having a research in this domain, we are happy to make the improvements without any kind of negative impact on the authors. And also, it's challenging to find good reviewers. This is on the other side of the barricade because you have to rely on persons that you know and persons that are very active in the field. And more than this, to have some time to dedicate to make the review.
Yeah, indeed, probably the most difficult issue is how to find reviewers. But as a section editor, you are really supportive, and supports the authors with the suggestions. The most difficult issue is actually for me is to write a rejection letter, especially if this paper was written by really famous, distinguished colleagues, but we cannot accept all the papers. So this is probably another issue that could be really challenging. We all section editors and associate editors we face with the same problem, how to find the reviewers, and we are all involved in many other tasks at the university, in different societies, and this is difficult to find time to work for the journal. This is the reason why we introduced a new position in our journal, the junior editor status, and you have also a junior editor, Andrei Tanasov. Has been this initiative helpful for you, and what is your thought on that?
Well, first of all, congratulations. It was a very good idea. It was also adopted by other journals, if I'm not wrong. So you are setting the trend here. And it was a very good initiative. And of course, we need some help. And also, it's helpful for us to be sure that we can transfer our knowledge to those who maybe will follow us. So also, it's some teaching activity here. And to have a junior editor near you, it's of course helping you a lot in making the discussion more powerful for the recommendation to the authors. And as you said, it is difficult to make a rejection because even in these cases, in the journal that you are leading, we are also making the recommendation to the authors what was not good and what can be improved. In other journals, it's just a letter, I'm sorry, it's not accepted, and that's it. But to provide the authors some thoughts and to find good reviewers will also insert their knowledge in those recommendations, I think it's essential. And here, the general editor can add a lot of things. And I'm very happy that I'm together with Andrei Tanasov in this activity. We are working together. We are discussing a little bit papers before making our insertion inside the platform with the final results. So it was a very good initiative, and I'm sure that all the other colleagues are approving it. Also, we are having some other advantages, but this is something collateral, and having access to a database of pictures, images, and up-to-date texts, it's also important for us to be, knowing the trends in medicine.
Yeah, I'm happy to hear that it was really useful, this idea. But my question is, I think that the junior editors thereby will learn a lot, not only from dermatology, but they will learn how to become an editor. And the current junior editors are our future section editors, probably. Maybe not in our journal, but in other ones. But anyway, they will learn the whole process, how to deal with the manuscript, and they will know the whole system, how does it work. And this also helps them to write their own papers, because if you read hundreds of papers, then and then you will write your own ones. That will be also better if you have you read already hundreds of others, and you know what are the major key issues that we have to take into consideration. That I think that this is really a good learning curve. But
we are preparing the next generation. We are preparing the next generation of editors, and for sure they will be without fear when will be approached by different journals, and they will indeed try to write articles with much more easiness. It will be something very easy for them from now on.
Yeah. What do you think? What were the major breakthrough in dermatology in the last few years?
Well, if we are talking about dermatology in general, I think that the understanding and the knowledge that is provided by finding the intimate mechanism, pathogenic mechanism of the diseases was providing a lot of new developments. I'm thinking of genetics here, who is also of big help for dermatology and venerology. And then we have the discoveries that are coming from this understanding of the pathogenic mechanism for inflammatory diseases, for oncodermatology, and of course for venerology.
Yeah, indeed, we know more about the pathogenesis, and now we have a lot of targeted treatments. And this is
for instance, well, I can add in venerology, because venerology seems very old-fashioned, and we are still using the drugs that we used 20 years ago, which is not the case in many immune-inflammatory diseases in dermatology. We have the biological agents that change a lot, but in venerology we don't have this.
Yeah, in venerology, you I know that you are highly interested in the antibiotic resistance to in Neisseria gonorrhea. Could you please talk a little bit about this, your own research, and what are you doing? What are your thoughts on that?
Well, this research is related with what is happening, because we started to understand better the pathogen. And in venerology, we are also facing some difficulties in research, because it's very difficult to culture some of the pathogenic agents. And some of them are closely related to humans. They are not developing on other tissues. So therefore, the research is not so easy to done. But what we are focusing right now, and what I'm doing right now, is trying to find some answers for the antibiotic resistance in Neisseria gonorrhea in this part of the world where I'm living, in Eastern Europe. And for this, we are just having right now, we are working in a project together with colleagues from Latvia, Lithuania, Poland, Republic of Moldova, Ukraine, Serbia, and Romania. And we are trying to find out what is happening here, because we have the results coming from different parts of the world, but not Eastern Europe. And what is alarming for us is the fact that all STIs increased very much in the last 4 years. So this increase is more than 40%. For instance, we have this increase in chlamydia infections, in Neisseria gonorrhea infection, in syphilis. And those are also observed by our colleagues in the United States. For instance, in the States, increases with 80% in syphilis. So all these reports are showing that something is happening with those pathogens, and probably antimicrobial resistance is important. So we have to find out which are the drugs, which are the dosages that we have to use to update our guidelines in order to have a good response. And I have to tell you that with Neisseria gonorrhoeae, we already know that there are some strains that are resistant to many antibiotics.
Yeah. And what are the main challenges in diagnostics and in the treatment?
Well, challenges are coming with the developments of laboratory tests, which are very advanced. And now we are using a lot of PCR tests in our practice. But somehow we have to be prepared to interpret the results and to assure our patients that what we discover and the results that they get must be interpreted in the context of their health. And also, we have to deal with the fact that our patients are having a lot of free access to medication like antibiotics, and we have to reduce this as much as possible. Other challenges are coming from the fact that we have this resistance, as we discussed, in many of the pathogenic agents. We have resistance in everything, not only in bacteria, but also we have resistance in parasites. We have scabies which develop resistance. We have patients with other parasitic infections which are also becoming resistant. And it's a nuisance. It's difficult to stay with them. We have to find a proper treatment, and we have to somehow be able to disseminate the knowledge so that the authorities can implement all those discoveries. For instance, in my country, we are not using ivermectin, which is oral treatment for scabies, for instance. But we know that this is a good treatment, and I'm knowing also that some other colleagues from Bulgaria, from Ukraine, for instance, are not using this. It's just an example. In HIV also, we have the problem with PrEP, which is not used for every patient. So with all the work that we've done, we are trying to give sufficient information so that those who are in charge can change the modality to address those infections.
Yeah, we're talking about the diagnostics and treatments, but probably extremely important is the education, continuous education. And I know that you have a webinarium in each month in the framework as UST. Could you a little bit talk about this webinarium?
Well, the webinar started during the pandemics. And we observe that a lot of colleagues are still interested in having a short virtual meeting of 1 hour, even when the pandemic time was over. So we continue with this. I started the webinars together with Dr. Derek Friedman from Ireland. He's well-known venerologist, and together we put together these webinars. Are still working. We have every month 150, 200, 400 participants, depending on the subject, and we try to put in front of our colleagues something that is challenging. When monkeypox was mentioned as an alert in WHO, we immediately jumped in with a topic for our webinar. When there is a change in the strategy of treating scabies, for instance, we have another webinar. And people are coming because we are giving the possibility to interact. And what our colleagues are willing now to have this kind of direct interaction, to be able to write a question in the chat and to seek for an answer immediately.
Yeah, this is really great to have monthly webinars with up to 400 participants. Really, congratulations. Could you please tell us a little bit about your research in wound healing and about your work, what you are performing in the UM's wound healing committee?
Well, wound healing is my other hat. One hat is with STIs, the other is wound healing. In wound healing, I'm more involved in the structure of this field. It was something new. I started together with Professor from Austria, and we founded this MGC in UMS, and we were starting with a curriculum. This was the first achievement in wound healing. We had a teaching curriculum for residents in wound healing, which was a huge step forward. And since then, we started to organize courses and workshops for persons who are interested in this field. So mainly we are doing teaching here in this field, and now we are preparing the new curricula for wound healing, which is improved with some new concept regarding how we are able to entrust our colleagues to perform some activities related to wound healing. And I can tell you that what I see is that it's a lot of development in this field. A lot of partners for industry are coming with new products. We are not using just bandages. There are a lot of technology inside, and this will be developed in the future for sure. So this is, at least I consider this a very interesting field that will develop in the future, and I'm very proud to be part of this field.
Yeah, and returning back to the journal, what would you suggest to our young dermatologists? Why to be involved in research, in writing papers, in reviewing papers? It takes a lot of time, but what is your suggestion for the young generation?
Well, I know that everybody's running for profit. I know that in dermatology, it's very easy to arrange something in the field of cosmetic dermatology, and you can retreat yourself in one office, private office, and you can be happy. But life is not only this, and dermatology doesn't mean only cosmetics. We have to take care of an organ, the biggest organ of our body, 2 square meters, and we have to be prepared to deal with other diseases. And for those who are young and who are starting their activities, I think it is important to be exposed to a larger field of knowledge in dermatology, to be able to select what is important for them and where they can perform better. And this task of writing a journal paper, it's very formative for their knowledge, because they are obliged to study literature, to do something else, a part of the curriculum. So they are broadening their horizon in knowledge on dermatology. Then to be able to put everything in a small text, which is reflecting the most important aspects of their research or of their patient, it's also important for them to be able to structure this information. I also can tell you that the journal, the ISD journal, it's important for me because it's allowing our colleagues to present cases, exceptional cases, which is not also permitted by other journals. And therefore, I think that we are close to our young collaborators, and they are very happy with this kind of interaction. They are able to present what they've done. They are not involved in big research. They are involved in treating some patients, and some of them are extraordinary, and they obtain good results, therefore gives them the possibility to present their activity. It's incredible.
Yeah. We still publish case reports, short letters, but it's always a question that if we publish more and more detailed case reports, then the impact factor will drop, because these case reports are frequently not cited. And this is the reason why other big journals don't want to publish case reports, because everybody is talking about the impact factor, or how is the impact factor, and we know if we publish a few originals or case reports, then the impact factor can be artificially increased just by a little bit manipulating the different manuscript types. But anyway, I think that for the young generation, it's always good if they learn a lot, and by doing this, they learn always some new things, and they will do always new initiatives. And this is the best way how to avoid the burning out. That is a common situation if you are doing the same, just earning money in the same private office, doing injections, Botox in each day, the 20s or 30s patients, then after a while it might be a bit boring. So just keep us young and not burn out, then I think it's also a good way to work for the journal and always be involved in new initiatives. So, Sorin, thank you very much for being with us today and sharing your insights. And see you soon somewhere else in the world in one of the derm meetings.
Thank you for the invitation, Professor. And thank you so much for what you are doing for developing the journal. It's an immense task.
Yeah. Thank you. Thank you. Bye-bye.